This lesson is on pediatric cognitive and neurological conditions. In this lesson, we will cover common cognitive and neurological conditions found in infants and children. Assessment skills, interventions, and nursing considerations will all be included. As with all pediatric diseases and principles, children should not just be thought of as small adults. There are many different factors which must be considered regarding the stages of physical, emotional, and psychological development throughout the different age ranges from infancy through adolescence and into young adulthood. The first disorder we are going to consider is attention deficit hyperactivity disorder, or ADHD. This is a behavioral disorder in which a child may display symptoms such as inattention, hyper or overactivity, and impulsivity. There are two main types of ADHD, the inattentive type and the hyperactive type. Children with the inattentive type do not display the hyperactive behavior seen in the children who have the hyperactive type. Nevertheless, the term ADHD is still used to apply to them. There are no specific widely accepted objective testing tools to definitively make the diagnosis of ADHD. Sometimes a therapeutic trial of medications is given in order to attempt to confirm or reject the diagnosis. Ongoing assessments of progress done by the parent, teachers, treating providers is the best way to determine if interventions have been effective. The child may also participate in their own evaluations. There are surveys and assessment tools which ask for frequency and severity of behaviors associated with inattentiveness, hyperactivity, and impulsivity. Interventions for ADHD may include medications, behavioral modification, and psychological counseling. The ability to thrive in a learning environment may be greatly reduced for a child who has ADHD if it goes undiagnosed and untreated. There may also be a significant degree of inability to maintain friendships and to be accepted within their peer group. If a child with ADHD is left untreated, it may have an effect on the other children in the learning environment due to their disruptive and attention-requiring behavioral manifestations. Autism spectrum disorders are a group of developmental disorders which are involved in a child's neurodevelopment. About 1/3 of children diagnosed with ASD have been found to have a specific genetic abnormality which correlates with the development of this impairment. ASD can be diagnosed in most children who have it by the second half of the second year of life. This may occur if the parent and pediatrician are appropriately tracking development and, if concerns arise, then conduct the appropriate evaluations. Almost all children with ASD have problems with social interactions and relationships and repetitive and restrictive behaviors. Many also have significant communication impairments and/or cognitive deficiencies. Therapy for ASD consists of behavioral modification, applied behavioral analysis, and, if indicated, speech therapy and occupational therapy. There are often associations between ASD and other mental impairments such as ADHD, or the delayed ability to perform self-care behaviors. The prognosis for improvement in ASDs is dependent on the severity and the presence or absence of associated impairments as described. Assessment tools for ASD include those such as the CARS test, Childhood Autism Rating Scale, and other survey-based instruments. Intellectual disability may be congenital, syndromal, associated with birth-related injury or other neurologic impairment, or associated with other mental impairments, such as ASD, or may be neurodevelopmental in nature. Assessments for intellectual disability include standardized IQ, language, and achievement testing. The specific test chosen to be used is decided by the examiner based on the child's age and other factors. Interventions for intellectual disability include special education settings and techniques, and if indicated, speech therapy and/or occupational therapy. One of the more common causes of intellectual disability is Down syndrome, or trisomy 21. The degree of intellectual disability ranges from mild to severe. and intervention and treatment vary based on the severity, as already described.